So if we recall, schizophrenia has a high level of heritability, right? So it's certainly a disorder where you see the characteristic increase in concordance rates between identical twins relative to fraternal twins. So fraternal twins have a concordance rate of 17%, and identical twins have a concordance rate of about 48%. And that, again, is an indication that, hey, genes are really important. But we also know that genes are not the only thing that are super important, because identical twins are 100% genetically identical, and yet their concordance rate is only 48%. If this was a purely genetic condition, it would be 100%. So let's take a look now at some of the environmental factors involved in schizophrenia. So there are certainly going to be environmental factors here. What's a little bit different than in some other things that we've talked about during this class are that many of these environmental factors are happening during the prenatal period, or they're happening very early in life, because we're going to see that schizophrenia can lead to neurodevelopmental changes in the brain. And so when we're looking at prenatal influences, we're thinking about prenatal complications, stress during the pregnancy, immune responses, and starvation during the pregnancy. In addition, early in life, direct brain damage or injury during the early years is also a factor. And so here is a pretty dramatic graph, I think, that shows elevated levels of interleukins. So this is an indication of an immune response, right? And so we're seeing that at the time of the first schizophrenic episode, there had been a high level of interleukin activity that had occurred during that person's lifetime. And in contrast, when you compare healthy volunteers, we see a very low level of interleukin activity. So inflammation and an immune response are going to be something that we're going to be looking at in development of schizophrenia. Let's take a look here at how that might work. This is what's called the winter birth effect. And the winter birth effect states that there is a greater incidence of schizophrenia during years where there is a high incidence of influenza. So this is an example of a type of situation that could lead to a response in the immune system. And here, let's compare low influenza years in orange with high influenza years. And so you can see that years where there's just a greater incidence of the flu, we are also seeing a jump in the number of births that will later on develop schizophrenia. Now, that jump is only during this time period, right? During this small number of months. If we look over here on the right, then we can see that the peak is happening between roughly, 2 and 7 months after the start of the epidemic. So we're definitely seeing that there is a jump in schizophrenia, suggesting that the period during the pregnancy was affected as a result of exposure to the flu virus. And so the winter birth effect comes about because the flu tends to correspond to winter, and so that's the winter birth effect. Now, what's going on during this neurodevelopmental period in the pregnancy is not fully known, but here is some evidence that there is certainly an effect on neuromigration. And so these dark dots that we're seeing here on the left are neurons that have been stained in the brain tissue. And I just want to point out that generally we can see there are these nice vertical columns of neurons here. This is very typical of what you would see in the brain. And so these neurons are in the hippocampus. And so again, these here on the left have generally a pretty orderly arrangement. I want to point out that there aren't too many down here and there aren't too many up here. In other words, the neurons migrated and clustered around in this region of the hippocampal tissue, resulting in, if you zoom out, kind of a striped appearance of the hippocampus. In contrast, we're not seeing that clean sort of arrangement here on the right. This is from brain tissue taken from an individual with schizophrenia. And you can see that we aren't seeing this narrow strip of neurons and a few down here and a few up here. There's much more sort of scattering of the neurons. And in addition, notice that there's not a large number of neurons that are neatly vertically arranged like we see here. So this is suggesting problems in neuromigration, that neurons in the temporal and frontal lobes do not migrate properly and line up in the outer areas of the cortex during the second trimester of the pregnancy as they normally would have. In addition, some changes are starting to occur during adolescence. In normal, adolescent development, there is something called a pruning of the nervous system. So there is a reduction in the number of neurons typically during adolescence, and it's just really the nervous system sort of fine-tuning and figuring out what it needs and what it doesn't need, and doing some pruning and getting rid of neurons that weren't needed. But in individuals who went on to develop schizophrenia, we can see that the amount of tissue loss is really much greater. So instead of it being, say, a 1% reduction of neurons for the most part, and maybe some 2 and 3% in certain areas, we're seeing reductions of between 2 and 5% in different areas of the brain. And so it's a much greater loss we're seeing in adolescence.